We've learned a great deal about COVID-19 in the last year, but new questions keep emerging. And so we still have our Jeff Semple on the case, trying to get answers for you from the experts.
The approach that we're taking allowed us to identify this patient immediately.
Exactly 1 year since Canada confirmed its first case of COVID-19. Some are wondering whether they might have been infected even earlier. Carol writes, "I think I had COVID-19 in January 2020, but was never tested."
It could have been influenza or another respiratory virus.
This infectious disease specialist believes she had the virus back in March, but was also never tested, though she says cases in February and January last year are less likely. After Canada's first case, doctors began testing some patients, but by the end of February had only identified a dozen infections, and the first confirmed community spread wasn't until March. But if you want to be sure, some private clinics now offer antibody tests.
The question that I'd like answered is there any planning underway with the public health effort to take into account the number of people who are now immune?
Some countries are considering so-called immunity passports for those who've recovered from COVID. Iceland, for example, now allows travelers with proof of prior infection to visit without quarantine. But Canada has no plans to follow suit.
Since we don't really know how long the natural immunity for COVID will last.
I was just wondering about wearing masks outside in the winter with COVID. I'd heard that COVID germs don't dissipate as quickly as they do in the summer.
She's right. Respiratory droplets fall faster in hot humidity than they do in the cold, dry winter.
It becomes a lighter and lighter droplet, and that can float around.
But the extent to which that raises the risk of infection is a matter of debate.
I think cold temperatures or warm temperatures mostly irrelevant. If you're outdoors and you're physically distanced from others, the likelihood of getting this infection is exceedingly rare.
But in a Canadian winter, masking up outdoors can't hurt and can help provide a layer of protection, not to mention a face warmer. Jeff Semple, Global News, Toronto.